Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Pros and cons of legalizing marijuana. The pros and cons of legalizing marijuana are still being debated. Today, 38 U.S. states and the District of Columbia allow for the medical use of marijuana. A growing number allow recreational use. /r/n/r/n. However, as a Schedule I controlled substance, marijuana is illegal under federal law. This Drug Enforcement Administration designation means that marijuana is considered to have no currently accepted medical use and a high potential for abuse. It also limits medical studies into the potential benefits of cannabis. /r/n/r/n. This article explains the positions of those who want to legalize marijuana as well as the arguments of those who do not want to see marijuana legalized. /r/n/r/n. Americans overwhelmingly support the legalization of marijuana. In fact, according to the Pew Research Center, 88% of Americans support legalizing marijuana. Of those, 59% say it should be legal for medical and recreational use, and 30% say it should be legal for medical reasons only. /r/n/r/n. Several possible health benefits of medical marijuana have been proposed. /r/n/r/n. Arguments in favor of using medical marijuana include /r/n/r/n. Marijuana is legal for recreational use in 20 states and the District of Columbia. In 20 other states, marijuana has been decriminalized. This means there are no criminal penalties in these states for minor marijuana-related offenses like possession of small amounts or cultivation for personal use. /r/n/r/n. Those who oppose the legalization of marijuana point to the health risks of the drug, including /r/n/r/n. The fact that the federal government groups it in the same category as drugs like heroin, LSD, and ecstasy is reason enough to keep it illegal, some say. As Schedule I drugs are defined by having no accepted value, legalization could give users the wrong impression about where research on the drug stands. /r/n/r/n. In the past, clinical trials to determine if marijuana is effective in treating certain conditions have been restrictive and limited. However, as medical marijuana becomes more common throughout the world, researchers are doing more studies. /r/n/r/n. Expert reviews of current research continue to say more studies are needed. In addition, many hurdles involve controlling the quality and dosing of cannabis with what is legally available to researchers. /r/n/r/n. One review of research noted that the long-term effects of cannabis are still unknown. Without more research into dosage and adverse effects, scientific evidence of risks and therapeutic effects remains soft. /r/n/r/n. Researchers need to evaluate marijuana using the same standards as other medications to understand whether it is valuable for managing any conditions. /r/n/r/n. Until the federal government downgrades marijuana from a Schedule I drug, widespread clinical trials are unlikely to happen in the United States. /r/n/r/n. Medical marijuana is increasingly available in the U.S. It is often used to treat chronic pain, muscle spasms, nausea, and vomiting, and to increase appetite. However, it can affect thinking and memory, and increase the risk of accidents, plus smoking it may harm the lungs and lead to cancer. /r/n/r/n. More studies are needed to understand the benefits of medical marijuana. However, unless the federal government removes it as a Schedule I controlled substance, research, access, and legality will remain complicated. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.